Good afternoon and welcome to Bariatric Friday. Today is June 3rd, 2022, and it's a Friday, it's a Bariatric Friday. My name is Kemal Erkan. I'm the chairman of American Surgery Center, and I have Dr. Isaias Irgau with me. Dr. Irgau, how are you doing?
I'm doing great, Kemal. Thank you. Thank you for having me again on another session for Bariatric Friday.
It's always our pleasure, and we have our patients, Samantha and Katrina, with us.
Good.
They're going through the process, and we are going to discuss different issues that they are going through. And just to kind of knowing our other providers as well, the American Surgery Center is the #1 bariatric surgery program, weight loss surgery program in the state of Delaware, perhaps maybe in the East Coast. Dr. Isaias Irgau, Dr. Gail Wynn, Dr. Mike Peters, Dr. George Ibrahim, Dr. Sachin Wade, and Dr. Rose Singh are our surgeons. Dr. Wade is a colorectal surgeon as part of our team. And we do have our dietitians who support our program, and Caroline Weber, Matt Wright, and Fran Tecano are part of our program. Before we start, we are going to discuss the intermittent diet and then how our patients may or may not benefit from it. But before we do that, Dr. Irgau, if you can just have a brief background on the bariatric and then the qualification for the bariatric surgery, please.
Absolutely. So bariatric surgery is a very well-established area of medicine now for the treatment of morbid obesity. In fact, right now, it is the most effective treatment we know for morbid obesity. And what is morbid obesity? Morbid obesity is defined as obesity where the weight is at least 100 pounds higher than the healthy or ideal body weight of that person. So if a person's ideal body weight is supposed to be 150 pounds, but they have gained weight and now they are 250 pounds, that defines morbid obesity. Another way to quantify this is to talk about body mass index, which is a number that we calculate by putting the height and the weight of the person together. And a body mass index of 40 defines morbid obesity. Sometimes even a body mass index as low as 35 can be categorized as being morbid obesity if the person whose body mass index is between 35 and 40 has already developed certain illnesses that are associated with obesity, like type 2 diabetes, high blood pressure, or sleep apnea.
Thank you. And just so that we have you kind of remember our patients, we have Katrina. Katrina is, well, these are, I don't probably have to say it, but these are not real names and real patients, but real cases. So I didn't make up these combinations. So Katrina is a 37-year-old, BMI 47. Her A1C is around 5.7. She is going through with the program to get gastric sleeve, and she does have sleep apnea, but no diabetes. And then she does have high cholesterol. Just to meet again with Samantha, which we know her already. Samantha is a 62-year-old who initially came to us for gastric sleeve, but we believe that gastric bypass would be the right procedure for her because she has heartburns. Her BMI is 42. And right now, both of these patients did come to us initially for different type of surgery, but the person who actually knows the best, our bariatric surgeons, guide the patients with the right approach and direct them to the right surgery type. So what would be the right one for them? What's the best for them? As a patient, we do have opinions, but the opinion, sometimes if you don't have the expertise, opinion is not as important. So you really do need to have the most expertise people in this field And that's what we have. And then that's why these patients did listen and went through with the recommendation that we made for them. So today we are going to discuss the intermittent diet and how we actually utilize that in our bariatric program. So both Dr. Erkan and I, we do intermittent diet time to time. I cheat more than he does, but I do go through long period of time without.
I never see you cheating, Kemal.
So, thank you, but that's not the case, unfortunately. So, Dr. Erkan, we discussed this first time at the end of 2020, and then since then we did bring it up and then made it part of our regular cycle. So give us the background on intermittent diet and how and when we use it for our program, for our patients. And I have follow-up questions after.
Yeah, so intermittent fasting essentially is an important tool when people are looking to manage their weight and become healthy. There's no question about it. I do want to comment on Samantha for a second, Kemal, if I may, before we go. Samantha did have heartburn, but her heartburn was very severe heartburn requiring multiple medications and leading to some damage to the food pipe. That's why gastric bypass was essentially the best procedure for her as opposed to going with the gastric sleeve. Now, when both Katrina and Samantha would first come to us, of course, we are talking about bariatric surgery as a way to really make sure that we take care of morbid obesity once and for all, right? That is the treatment, really. That's the most effective treatment we have. Having said that, we do also talk about other changes that they have to make in their lifestyle for them to start becoming healthy. We certainly do not want to offer bariatric surgery as the only thing they have to undergo and then forget about changing lifestyle, forget about being physically active. Those elements are still very, very important. When we talk to our patients about bariatric surgery, we don't say to them, you know, you tried to diet in the past, you tried to exercise in the past, you did not succeed. Stop those things and let's do bariatric surgery. Not at all. What we tell them is continue to eat healthy, continue to try to stay healthy from your eating habit and also the physical activity. And we're going to add this powerful tool of bariatric surgery to that for you to become healthy forever. That's what we talk about. And intermittent fasting is one of those tools that we talk about. I personally think it's actually a great tool. And you and I, Kemal, have talked about this many times before. So what is intermittent fasting when compared to other diets? Well, most other diets focus on what people should be eating, right, Kemal? Whereas intermittent fasting focuses on when people should be eating, right? That's critically important. And this, in my view, is so important in our modern society where we are awake a lot longer than we used to do, right? We have 24/7 television, we have the internet, we have games, we have online chats, right? And with all those activities, we associate eating as well, right? So essentially, we are awake longer, and in our waking time, there is no limitation as to when we eat. Essentially, our digestive system is open to the business of eating all the time we're awake, right? If you take any other business, Kemal, you would know that there are closing hours and opening hours, right? Our digestive system, which is an incredibly complex system that has to take a lot of energy and a lot of activities to process any type of food we put in our mouths, is always open as long as we're awake. We always put in food in our mouths. That is one of the problems we have. And one way to tackle that is to define times in the day in which we say, look, from this hour to this hour, I am close to business. I'm not going to eat. From this hour to this hour, I am open to business. I'm going to eat. So we are changing our 24-hour day, right, into periods of fasting and windows of eating. That's essentially what intermittent fasting is. So we're focusing on when we eat. We're trying to say that when you are awake, when you're not asleep in your waking hours, don't be open to eating all the time. Define the hours of the day in which you are not going to eat at all, and then define the hours of the day in which you're eating. Surprisingly, Kemal, this works well. And it may be probably the most natural way for us to really eat healthy in a way, if you think about it. Because as humans, we have evolved most of our existence, particularly as Homo sapiens, most of our existence, we lived without really not having an assurance that we will get food, right? Before agriculture was established, before we were able to domesticate animals, right? We used to hunt, we used to gather. We never had a planned time for us to get food, right? So we ate when we found it. And when we didn't have the food, guess what we did? We didn't eat. And our body was fine with that. Our body actually evolved to cope with long periods of fasting. We're not talking about hours here, even days without eating. So by doing intermittent fasting, by having these periods in which we don't eat during the day, we're actually going back to the natural rhythm of our body rather than reinventing something new.
So I think for us, when we first started doing this, one of our meetings, you said, well, there is this guy from England, some doctor, who actually did this for aging.
Yes.
And then, well, the other benefit of that they didn't know that was coming with it was weight loss. Now, the aging, when I was processing and analyzing this, it made a lot of sense. Why something would age is kind of going back to your point of business being open nonstop. So if the organs are just working nonstop, and then we are aging.
Yes.
Right? So then that actually has this other benefit of the weight loss. And then that actually, I kind of connected that with, now these days, I'm trying to actually put a little bit more time on the sleep side because as you know, that I don't sleep enough. Because I did a lot of different things, and then there was some issues with the weight that not eating didn't help. But then I was looking at other stuff, and then one of them is the sleep. And then the logic of sleep, the rationale for the sleep, is actually maybe the foundation of the intermittent diet, because the reason we sleep, we want to actually give all those organs a break. So the way that we are designed from the beginning, where we didn't have access to food, when you make references to these old days, it's not like in our ages, like this is, 10,000 years ago, is different than what it is today. We have access. Today, I don't have any food, actually. You can be proud of me. So last time we did this, I remember it was the holiday time, and I had like cookies and other stuff everywhere. So because the access to food is so much out there, like we did a baby shower in the office yesterday, and then men were allowed to be there. So the food is just like, it's everywhere. Everything is food. So that brings the nonstop eating or not giving a break, not having that discipline, and it makes a lot of sense. But what I'm more interested in for Samantha and Katrina's standpoint, would they ever have to do that during this process? Now, what Katrina actually reported to us, she did gain about 12 pounds. And as you know, her BMI is about 47. And then gaining 12 pounds is not a good indicator for us and also for the insurance companies. And we still have time for her surgery. So how would we utilize this for Katrina?
So it's wonderful. So, when we talk to our patients, obviously we want them to start making changes, right? Right away, right? So for Katrina, for instance, in our first encounter, we discovered that she was drinking soda, for instance, right? That's one of the first things I told them. Look, soda is the enemy here, right? It's our enemy. It's got to get out, right? Not only we're getting excess calories, but it may be interfering even with our metabolism in a negative way, right? Once we talk about these basic things, then we talk about other things that they could do. Of course, our nutritionists will have plans for them that will start giving them some control of what type of food they are eating and making changes that are healthy. But on top of that, I personally like to talk to our patients about timing of their eating as well. This issue about not being open all the time. Some of the patients may say, for instance, that they don't eat breakfast. Now, in the old days, we used to say, breakfast is the most important meal of the day. You must eat breakfast first, right? Even if you're not hungry, you got to eat it. Well, that may not turn out to be the best thing, Kemal, right? So if you're not eating breakfast, then have your coffee or your tea without sugar, without any creams, right? And then try to stay on water as long as you can, right? So if your first meal is going to be at 12 p.m., and your last meal the night before was at 8 p.m., then right away from 8 p.m. the night before to 12 p.m. the next day, you have been fasting for 16 hours. Now there's only 24 hours in the day. If you've taken that 16 hours, then you're left with only 8 hours in which you can eat, right? Now, because your eating window is so narrow, naturally you're going to be eating less. Right? So there's that advantage. That's the side effect of intermittent fasting, right? But on top of that, as you correctly said, Kemal, we are not engaging our digestive system in a continuous fashion because as you gave me the analogy some time ago, you compare the digestive system to an oven as opposed to a microwave as opposed to an oven, right? It's either on or off, right? We cannot say to our digestive system, okay, we're just going to have this little snack, so just work a little bit. No, once we put the food in, all the mechanisms are turned off, all the hormones start working. So this machinery is going on and on and on, right? So no wonder we age faster because of the amount of food we're eating on a continuous basis. So giving ourselves a break is important. So this type of education is important for our patients when we first encounter them. So we would talk about that with Katrina. But then there is another time, which I think this is important also, Kemal, and that is after the surgery, right? Remember, the most exciting time after the surgery are the first 12 months. The weight is coming off, people are excited, right? But then there is this settling down, the routine, the continuing to stay focused, which is going to be years after that. And people sometimes lose focus, right? They find themselves gaining some weight. They come back to me and say, what can I do? One of the first things I talk to them about is time-restricted eating or intermittent fasting. I say, look, have these hours of the day in which you're not. And then when you sit down and eat, your stomach is very small because of the surgery. You're not going to be able to overeat. So automatically the calories that you're going to consume are less. So time-restricted eating or intermittent fasting, that's the other way to call it, Kemal, is useful for us not only in preparing patients for bariatric surgery, but afterwards as well.
So let's talk about that oven analogy. I don't know if we explained that. So what I was saying on that, when you have to heat up something at home, something small, when you turn the oven, it needs to heat in the beginning. So it spends like 10 minutes to get to, let's say, 400 Fahrenheit. Then that 10 minutes. And then it's going to take longer to do the heating and it's going to cool off. So do you want to do that for, like, if you have a, like just little food somewhere that you are trying to heat up, that entire process, the energy the oven is spending, can be done in the microwave in less than 2 minutes. So every time we eat some small food, like our body is not a microwave, so it's an oven. So then the whole system starts, the entire system actually starts working from our brain to our colons, right? So like everything is now completely, they're like, well, there's new intake. So what are you going to do? What is it? What taste it is? Like, is it good? Is it bad? Like everything is working. And then we age during that process if it's done multiple times during the day.
Yeah.
So that makes a lot of sense, but following that and adopting it and getting that discipline is difficult. But let's just try to kind of give there are different ways that intermittent diet can be happening. It doesn't have to be 16 hours. Even if it's, let's say, someone, Katrina's job, she works at one of the local banks.
Mm-hmm.
I made this up.
Okay.
So
that's actually common, yeah.
So she works from 8 to 5.
Mm-hmm.
So someone who works 8 to 5, I'm gonna guesstimate that she goes to bed around 11.
Mm-hmm.
So let's just make this more practical. So if I stop eating around 10 p.m. and if I'm able to go through the night without eating or drinking, which even for the better sleep, drinking unnecessary stuff is not good before you go to bed anyway. So then 10 p.m. So can I survive until 10 a.m. next morning? Most people are going to say yes. So that gives us 12 hours already.
Yes, absolutely. Absolutely. So, 12 hours right there.
12
You're
hours.
Right. So it could be 12 hours. It could be 14 hours. It could be 16 hours. The level of tolerance.
If I'm able to, like if she takes a lunch break at 12 noon, that gives us additional 2 hours.
Yes.
So she's at 14 hours. And if she's able to do this, that 14 hours is resting time, which will help her to get rid of that 12 pounds. And therefore, even in the future, if she needs to use it, it's a good way to kind of, like once in your head it's doable, then, because this example, I mean, you and I, we went through this a couple of times, and what is so difficult is not, because at night we don't eat anyway. So can we add like a couple of hours before we go to bed and a couple of hours after? And,
Absolutely.
and are definitely able to do that. And this is the one that I usually go through, Dr. Erkan. So I know you think that I'm no longer, but I'm lying. So.
Thank you for your honesty.
Well, but today, like I didn't eat lunch, so it's, what time is it now? It's 3:30. So
pretty good.
Although I think Sean is getting something. So right after this, but it's easy to do it if you can actually think about, like, okay, sleep time, add a couple hours beginning to the end. And you don't have to do it all together at once. You can start doing it. And if you repeat it maybe 3 times a week, I mean, for me, it's every day, except the weekend.
Absolutely. But the whole idea of having to eat, breakfast, lunch, dinner, these are more norms of society, customs, cultural things, as opposed to necessities, if you think about it, right? I mean, we were taught that we had to sit down and eat meals these 3 times. Well, if we go back in our history, there will be a time in which people never had any set time for eating, except when food was available. And there was time in which food was not available. So they never ate, essentially. So the idea that we necessarily have to go through these meals is something that we have really imposed on ourselves based on norms and cultural habits, as opposed to being necessities, if you think about it, right? Now, we say, oh, will I be able to be hungry? Well, it's interesting. Hunger does not increase over time, right? You are hungry, and then the hunger fades away, particularly if you drink some water or something, right? We're talking about, will I be able to go 12 hours? Will I be able to go 14 hours? Well, what will stop you? Hunger. But hunger doesn't increase over hours. It just comes, stays with you for a little bit, and then it fades away. That's how it works, essentially. And then, is it safe? For the vast majority of people, it's absolutely safe. Of course, if people have diabetes, if people have other illnesses, young people, pregnant women, that would not be something that we would necessarily promote. But, for the vast majority of people, it's absolutely safe to be able to do that, because most of us have enough stored energy that we carry with us that will take us not only hours, but also days if we wanted to, right? But, it's interesting, Kemal, the way we think about eating an energy supply to our body, right? We're thinking, okay, I have to work today, so I must eat, right? But we are already carrying pounds and pounds of stored energy with us that could carry us through. right? So if we were to compare ourselves to a vehicle, a car, right? Come on, a car needs energy. We have to put gas into it, right? But we put gas only when the gas tank comes down, come on, right? We don't say, okay, just because the gas station is available, I'm going to buy an extra tank of gas and put it on top of my car and then carry on like that. We don't do that, right? We just put gas whenever we need it. But for us humans, right, the way we are treating energy, and that's probably one of the reasons that makes us eat so much, is because we don't think of utilizing the energy that we have stored in our body as fat to carry our function, right? We say to ourselves, okay, I must eat this many times. And also, more importantly, food is available. And then if you go beyond that, food has stopped being a source of energy for us. It has become a form of pleasure and entertainment, right? Whether we are socializing or whether we are watching TV or playing games, this is an additional thing. So our body processes the food that we eat for needs or for pleasure in the same way. It has to churn the whole energy. And the end result will be that we have excess energy that it has to be changed into fat and stored, and that's when we gain weight, essentially. So very often, people will say to me, well, I don't understand why I'm gaining weight. Well, we are eating way more than we need. That's why we're gaining weight.
We have a lot of excess.
Excess, absolutely. Excess. And we have framed our society, particularly in modern American society, where food is so easily available, as you just said, right? I mean, I was in the office yesterday in Apex, Kemal, and if I went to any of our administrators' office, there would be a big jar with candies, there would be chocolate and other things. And when you're sitting computer work, it is so easy to just, for your hand to go there and grab something without even thinking about it. And then I was telling you about my son, right, Kemal, who, used to call me saying, hey, Dad, can you go through this store and bring me food? Now he doesn't. You know what he does? He does DoorDash or where he just he doesn't even have to talk to anybody. He just puts something online and somebody will bring him the food right there. How easy it has become for us as humans to find food. Well, it is great. It is good. It's a blessing to have abundance. But when you don't pay attention, then we are obviously paying the price here with obesity and all the illnesses associated with it.
So, the pleasing each other with food is unfortunate. That's like right now, my trip is coming up. Being in Turkey and being with my mom, and she has this wonderful assistant at home, and they already start planning what they're going to do. Food, and they know that I have gluten allergies, and it doesn't matter. Like when you're in Turkey, you don't have gluten allergies, so they just want to please you with food, and that's something that it's going to take several generations to make people understand that we don't need it, or it's not how. Like we are not actually. Well, personally, that doesn't please me. I mean, if you ask me what I want, I'll tell you what I want, and then you are going to just serve that. No, that doesn't mean anything. So they have to do their traditional stuff, and it's probably the entire week and the 2 weeks is already planned. So now, Dr. Ergau, I'm going to go to Samantha. Samantha, as you know, is older than. And then she also does have diabetes. Would you recommend the same thing for her with diabetes?
Sure. So what I would do, Kemal, is that I would be supervising her, right? When I do that, what I don't want people to do is to try intermittent fasting when they have diabetes without the supervision of their doctor. So it is safe. She can do it, obviously, but first of all, she has to be knowledgeable about the diabetes itself, making sure that she knows to check her blood sugar on a regular basis, and then to understand symptoms of low blood sugar as well. And then, she has to have a good regimen of medications that she's taking. Obviously, I need to know the medication she's taking, right? With that knowledge, I would be able to guide Samantha to do this as well. When I was talking about it's not for everybody, and we have to be careful about people with diabetes. What I meant is I didn't want people to just go off and try this really without talking to their physician, particularly when they have illnesses like diabetes. Otherwise, yeah, absolutely. Absolutely. In fact, there are studies that show that diabetes does improve with intermittent fasting as well.
I want to share something with you. Let me actually see if because it does have a patient name on it. I'll try to just take the patient name out. I need a couple minutes. So what I have seen, now in our case conferences, the one in the morning, not the bariatric one, but the 8 a.m. one.
The ACO one.
ACO one. Yeah. We have these patients. Sean is in my team, and I usually ask him to take a screenshot of the chart when we are going through this. So I'm going to bring this up. What people need to understand is, what we are dealing with, the entire issue of the morbid obesity is affecting our lives severely. So when we don't do something about it, it actually even goes, it just becomes more severe.
Yeah,
and
absolutely.
I want everyone to hear us loud and clear. That if you give me 10 more seconds,
yeah, of course.
I have 20, almost more than maybe 20 patients in the last 2 weeks, not identical but similar to this situation that you'll be seeing in the third video, the UMed TV one. And then Sean is sending me all those now, but I just made one. But thanks, Sean. Let me make sure that there's no patient information on this one. This is one of our patients who works at an Asian restaurant. Now, when I saw the case today, I mean, it really just broke my heart, because this guy was going through the surgery last year, stopped the process. So when I say this, I mean, you know me, Dr. Malik, I mean it. So it really did break my heart to see him. He started with 360 pounds in the beginning. His estimate is 430 pounds. He's most likely over 450. Young person. We were gonna get him operated on him at the surgery center. Now he's close to 70 BMI, and we won't be able to do that. But delaying, not doing anything, not treating, is one of the many examples that we see. And this is not an isolated event. So since I believe Sean sent me some more, I can, let me see.
Essentially, you're showing the weight really going up and up over time, and to really high levels, starting from, we were at around 360 in 2021, and now all the way up to 430 in 2022, essentially.
That's his estimate. He didn't come in for an in-person yet. And here's another patient who, this is a different patient, didn't go through the process. It's like, and I also, even if they didn't start with us, if this is their first time, I checked their history of what's happening with their weight. So once they are at the level of morbid obesity, it is just increasing.
Yes.
It's not something that it's getting better or you lose weight. That's not happening. So that's why actually even talking about the intermittent diet is, but even you are not going to get the surgery, do something about it.
Yes. Yeah.
So
Absolutely.
that's why we are actually like, we are talking about this. So here, I'll show you one more picture. There are 20 of them. These patients right now, current BMI is 62. But then as you see, like how the weight gain is happening.
Yeah, absolutely.
And this is the fight that we are putting out there, trying to change the stigma, trying to get the right help for our patients, trying to work with our primary care so that they don't let these patients leave their exam rooms without a proper morbid obesity treatment. So, I mean, I've been saying this. This is wrong. This patient should have been sent to us by the primary care, not by us from the care coordination team. So as you can see, all that's happening is going up, and it becomes out of control. The prevention, just like anything else that we do, prevention is the main thing. And this patient, if they don't want to do the surgery, fine, just learn something about intermittent diet. So this is a healthy way and doable. Like Dr. Erkan and I, we are both under BMI 28, most likely, at least. I know that he's definitely, but I'm probably 27 and a half. So we do it to maintain we are going through. And that's after a certain age, things become slower. And you do need to change something. It becomes more stubborn if you don't do something about it quickly. So now, going back to our ladies, so you would actually do, you would recommend the intermittent diet for both of them. And we do want to lose some weight anyway before the surgery, right?
Absolutely. Absolutely. So it's not a requirement, of course, right? But I think trying to get into a lower weight before surgery is always a good idea, right? Particularly because in the short term, there is a loss of what we call visceral fat, which is the fat that is inside the abdomen, right? And lowering that load of fat is actually a good thing for the surgery, because the more visceral fat there is, the more challenging the surgery is. So working through that, and that's part, the reason why we have the special new direction diet for 2 weeks before surgery, specifically because we want that visceral fat, particularly in the liver, to come down. So, of course, not everyone may be able to do intermittent fasting, but it is an option that we present. And for some patients, it's just natural. They like it, they will do it, and they will feel better about doing something that doesn't force them to really choose what foods they're going to be eating within reason, but at least time themselves. And particularly when they are busy during the weekday, busy with work, they are able to do that and eliminate all the temptations that they have by removing, for instance, all the snacks from their desks, choosing not to participate in eating events, in their setting during certain hours. That can restrict the amount of calories that they ultimately will be eating.
Absolutely. I mean, as you said, weekdays is a lot more manageable. And the weekends, actually, Saturdays and Sundays, the breakfast can be later.
Absolutely. It can be.
This is all doable, and these are all available. So we want to share this with everyone. And again, our goal is to help those who are looking for these types of solutions in a safe way. And our program is one of the most expertise and most number of surgeries that we have done. And this is what we do. Bariatric is what we do. And this is the right place if the patient decides to go through the surgery, and we'll make sure that they get all the help that they need. Dr. Irgau, thank you for joining me today, and we'll be back next week.
Thank you, Kemal. Thank you.
Thank you again. Bye-bye.
Bye. Have a good weekend.